Good day. Today we are going to discuss the quarter 2 week number 5 and 6 lessons in health. This about the baby now, the newborn screening, breastfeeding and immunization. Let's begin. A newborn is a child from the time of complete delivery to 30 days old. Remember the days again. 30 days. For a newborn child, a newborn screening is needed. This is a simple procedure to find out if the baby has a congenital metabolic disorder. It is ideally done on the 48th, 72nd hour of life. However, it may also be done after 24 hours from birth. A few drops of blood are taken from the baby's heel, blotted on a special absorbent filter card and then sent to Newborn Screening Center, NSC. This might be painful for a very young baby, but it is necessary. Results can be claimed from the health facility where NBS was availed. Normal NBS results are available by 7 to 14 working days from the time samples are received at the NSC. In a newborn screening, Apgar is also needed. Stands for Appearance, Pulse, Grimace, Activity and Respiration. A tool used for assessing newborn babies. A negative screen means that the NBS result is normal. A positive screen means that the newborn must be brought back to his/her health practitioner for further testing. Always remember the positive and negative screens. The Apgar, Appearance, Pulse, Grimace, Activity and Respiration. The next slide will explain further the Apgar. Here is the example of newborn screening Apgar. For appearance we have blue, pale for 0, pink body and blue extremities like hands and feet for 1 point or overall pink for 2 points. For pulse we have absent or none for 0, below 100 beats per minute for 1 point and over 100 beats per minute for 2 points. The grimace or the reflex irritability we have floppy, minimal response to stimulation and prompt response to stimulation. Now for the activity of muscle tone we have absent for 0, flexed arms and legs for 1 point and active for 2 points. The respiration now are absent for 0, slow and irregular for 1 point and for 2 points we have vigorous respiration. Now breastfeeding is the traditional and ideal form of infant feeding, meeting an infant's nutritional needs for his first 4 to 6 months of life. Breastfeeding makes the baby healthier for as long as the mother is also healthy. Our government and WHO or the World Health Organization promotes breastfeeding because it has of advantages for mother and most of all the health of the baby. Now let's talk about the advantages of breastfeeding. When a mother gives birth, there is a hormone in the mother that will stimulate her breast to produce milk. Human milk is clean. It lowers the risk of intestinal illness and general infection. Mother's milk provides a host of protective factors, both cellular and hormonal. Breast milk contains antibodies that help the immune system of the infant strong. It is non-allergenic and easily digested. The mother's milk in the breast is continuously replenished, so it is necessary to breastfeed the baby because that is the purpose or function of the breast. If a mother will not breastfeed a baby because she needs to stay away, a breast pump may be used to collect the milk and store it in a cold storage, but not for long. Studies shows as well that those mother who refuse to breastfeed her newly born child and she is capable of breastfeeding, have a bigger chance of having breast cancer. So breastfeeding is healthy for both mother and child. Now let us identify different kind of immunization needed by the child. What is immunization? It is a vaccine to prevent infection by disease. The following are the essential vaccine for infant. We have BCG, anti-TB, to be given in 1 month old to 7 years old. OPV, anti-polio vaccine, to be given between half month to 32 months only. And MMR, measles, mumps, rubella, for 9 months to 1 year old. Most of this immunization are given for free in the public hospitals and local or nearby health centers. It is very important to have the baby complete immunizations, especially nowadays that we have a lot of different illnesses and only the protection of immunization will prevent the baby from having. We have DPT, anti-diphtheria, pertussis and tetanus. To be given between half month to 32 months only. DPT, anti-diphtheria, pertussis and tetanus. To be given between half month to 32 months as well. Hepatitis B vaccine. To be given between half month to 32 months as well. That's all for today. Thank you and God bless.